I would like to greet everyone. To, Today is Sunday, July 17, 2022. And again, my name is Dantiste. I am a family nurse practitioner based in West Palm Beach, Florida. Um, so I have decided to come today with a topic is very close to my heart because so many people has been affected to that disease, and we might think that cancer and COVID, um, it's really the big issues in healthcare, but really heart disease is the biggest one. So today the topic will be what are the red flag? What are the warning symptoms of heart attack? As usual, we're going to start with an inspirational quote or thoughts. And today the quote will be taken from Tony Gaskins Jr. That's his quote, so I have to acknowledge him. So the quote states like this: Not everyone will have the heart you have. Not everyone will appreciate you and what you do for them. Sometimes it won't be easy having a kind heart in a cruel world. Be prepared. So when I read that quote, I said, you know what, it's so true. Sometimes you want to do good stuff, but it's not everybody they will appreciate what you do for them. But regardless the way they accept it or not, just keep doing what is good. And everybody has a purpose in life. Just find your purpose and claim it, and just deliver your purpose no matter what will happen or what people say, as long as you feel good with what you do. So as we see, before we go to with the pictures, heart attack or heart disease, it's related to circulatory systems. Okay, so when we are talking about circulatory system, there's there's two organs should come to mind. It's your heart, which is this one. This is your heart, and your brain. So your if they put that brain in there, you're going to have your brain inside your head. So this is the two main organs really when we talk. Of course we have more, more organ than that. We have the liver, we have the lungs, but for the topic of today, the main organs we will discuss today regarding the respiratory, not respiratory, regarding the circulatory system will be your heart. So let's get some facts, okay? When we are talking about heart disease, heart attack, MI, or myocardial infarction, it's all the same. Okay, some facts about heart attack. Um, First of all, the percentage of death is as high as 50% in cases when heart attack occur, and if you don't seek for help immediately. Okay, so that what which what that's mean? That's meaning um if somebody has an if somebody has an heart attack and you don't seek help immediate, as soon as possible, so you don't call 911. So the 911 uh, um, staff will bring you, to the nearest hospital close to your house. The likelihood for you to die is 50%. So that's why it's so important when you think that you or someone has uh, an heart attack to call 911. Okay, and we regardless of the age. So it doesn't matter that what age that person has. Once you discover or you think that person has a sign, so you need to call 911 as soon as possible, so they can bring that person to the nearest hospital. Also, there's a total number of, in the US, the total number of heart attack is approximately 1.5 millions people who have that. And mostly those number fall into, mostly is, all the person who have that. So in 1.5 million person who have the heart attack, mostly we found those um, symptom in all the individuals. And someone has that, in the US, according to CDC. CDC is controlled for is Center uh, Diseases Control. So according to CDC, someone has a has heart attack every 40 seconds. This is in the US alone. And also each year we have approximately 805,000 uh, people in the US who has heart attack. So that's less than 1 million person who has that. So it's about 805 uh, uh, thousand people who has heart attack every year in the United States. So that's a lot. Okay. So as we can see, heart disease is this is a epidemic. This is the first cause of death in the U.S. is heart disease. It's not cancer. It's not COVID. It's not respiratory diseases. It's really heart disease. So it's very important and serious. So the cause of death in the US as of February 2022. So we have the first one, it's heart disease. So your heart, your heart, your heart, your heart disease can be like your CAD, which is coronary artery disease, and can be your heart attack. And the second death in the U.S. as of February 2022 is cancer. The third one is COVID-19. As we know, the beginning in 2020, it was a chaos here. So many people die from COVID-19. Mostly was the older people, but still, COVID-19 is not the first cause of death here. It's is, this is your heart, this is the heart disease, the disease related to your heart. This is the first cause of death here. So we have the first one is heart disease, the cause of death. The second one is cancer now. The third one is COVID-19. And the fourth one is your stroke, your cerebral vascular disease. This is your stroke. Also, we have more facts. Um, so, what are the most common chronic diseases? So, the most uh, common chronic diseases in the world, in the whole world. The first one is ischemic heart disease or coronary artery disease. This is the same thing with here in the US. No matter where you you are, it seems that the heart disease, this is the first one. And also, they said also the deadliest disease in the world is your coronary artery, your coronary artery disease, which is your CADs. Stroke or stroke. This is one of common chronic disease. We have lower respiratory infections, can be pneumonias. We have COPD, which is obstructive lung disease. And we have also the trachea, the bronchus, and lung cancer. This is another chronic disease. And we have the diabetic. Diabetic also fall into chronic disease. And the next one, of course, will be hypertension. And of course, we have more than that. We have hypothyroidism, we have the hyperlipidemia, your cholesterol. We have your acid reflux. So we have so on and so forth. But the main one, they are the main one. So just to let's review, the system. So of course, when we are talking about thought attack, we are talking about your heart. Okay, so this is your body, this is your left side, this is your right side, and your heart is right here, right? So what we need to know, all the blood in our system, they all flow, into your heart. They all come from, the lungs. The lungs, they go into the lungs and get their oxygen, and then they perfuse, into your heart, and then from your heart they deliver, the blood goes through the veins, they go, into your brain, they go into your heart, um, and your arms and your legs and all the vitals organs, in your body, such as your your stomach, your liver, your pancreas, your gallbladder. So, but mainly, all your blood, they go through your lungs and your heart. All the blood we have. Okay, so the blue is when the blood, when your blood, they don't have a oxygen. So this is your arteries, and this is your veins. So that's why they are red, because they have oxygen. So your blood turn, from blue to red. Okay. And when we are talking about the about heart attack, so that's meaning either you have a partial or complete blockage inside your heart. It could be any place, like your left ventricle, your right ventricle, your atrium. It could be all those spots. So whenever you have an artery, your artery who has a blockage, and the blockage can be either partial or complete. So that's when that person will develop the heart attack, and this is major medical issue. So when that happens, they sign up symptom. I will go over with you. So once you once you think that this is a sign of symptom, we cannot sit on those symptoms. We have to call 911. Don't call your friend, to come and pick you up, or don't try yourself to drive uh, uh, into knee into a knee west hospital. So call 911, because when the 911 come, they will give you oxygen, and that can help your heart, uh, etc. So yeah, so you have those heart here. Again, they show you those big arteries. I don't have to go in depth. So but the main thing you need to know is that all the blood, because we have like, I don't remember, like 5 liters. We have so much blood. So all the blood, from in our body, they all have to go through your heart and your lungs. All right. So now, so now we are going to talk about the sign of symptom. Okay. So this is what I'm more. Let me. Oops. Put that. Okay. So let me drink some water. Really, this is what I would like to help you guys to recognize. Okay, it's sign of symptoms. When something happen, it's good to know what it is. Okay, when we need help. So if we can know the sign of symptoms, it will be easier for you to know when to seek help. But if you don't know the sign of symptom, if you don't know, okay, the sign of symptom is related to what, okay, if it's important, to seek help, it really, if you don't know what it is, it's going to be difficult to seek help. That's why my my role is to really go is to really explain to you guys what symptom to look for, okay, and what to do. So the red flag, okay, this is the red flag of heart disease. The red flag, not mainly your heart attack. If you have those symptoms, you need to seek help. You need when I said seeking help, I'm not saying to you take your car and drive or call your friend. When if you realize that your symptom is could be heart attack symptom, please call 911. Don't hesitate, because by treating heart attack time, it's I cannot tell you enough how important is the timing. Okay, the timing can make a big difference. So that's why it's important to recognize the sign and symptom, to recognize uh, if it's an heart attack you're having, so you can call 911 to come as soon as possible to bring you to a hospital which is near to your home. Okay, so your warning sign, the red flag, okay, of heart attack. So to begin with, men and women, the symptom, they're not the same. Okay, for men, the symptom is mostly, it can be, they feel like they have a crushing pain, like they have an elephant who sit on their chest. Okay, they have the pain. Women, they are different. Women, they have more GI symptom. So we have to really make sure that to not think that the side of symptom of heart attack, women and men is the same. They are not the same. They can have different symptoms. So for men and women, most heart attack start slowly with chest pain or discomfort, right? For most, so it starts. So you have your chest pain, you have discomfort. And also, we have to distinguish between chest pain and acid pain. Okay, it's two different. It's two different pain. So, but for men and women, most heart attack start slowly with a chest pain or a discomfort in your heart, right? The heart I show you before. And women are most likely to also experience shortness of breath, nausea, and vomiting. This is your let me put it closer. This is your GI, back or jaw pain. So they can have jaw pain and the back pain. That's the women. That's the women. And men, them it's most likely look like, it's most likely their heart discomfort and the big chest pain they have. So the warning sign, the red flag for heart attack, we have to remember that. Okay, that can happen to you, that can happen to your loved one, that can happen to your neighbors, whoever. So if you know the sign or symptom or the red flags, I call them the red flags. So you know that you will need help as soon as possible. Again, we have to remember again, the timing is very important. We will go over that after. Okay, so what are the warning signs? The warning signs for heart attack are chest discomfort. Okay, you feel pain right here on your chest, on your heart, where your heart is. So chest discomfort. Most heart attack involve discomfort in in the center of the chest, right here. That lasts for more than a few minutes, or that goes away and come back. So the discomfort, the chest pain can come and go back, back and forth. It can feel like a uncomfortable pressure, squeezing, fullness, or pain. So the pain is not only one this description; it can have many description. Okay, it can be squeezing, feeling. It can be like you feel like that sharp pain, or you feel like it's an heavy, like an elephant. Some people report that they feel like it's a big elephant who sit, on their chest. So you know how big the you know how big an elephant is. So if somebody feel that, that's meaning it's a big pressure. It's like a pressure they feel. And also, the warning sign for heart attack also can be discomfort in other areas of the upper body, which is like this, from the waist up. So the symptom can include what? Pain or discomfort in one of both arms. The person who's having a heart attack can also feel pains on both arms. They can feel pains on their back, their neck, and the jaws, which is here, and their stomach. Okay, so it can vary. It's not only one symptom, but we really need to know that if we have discomfort um in those part of your body, which is your both arms, the back, your neck, your jaws, and your stomach, you think about heart attack. It's important. And also shortness of breath, with, or it can be with, or it can be without chest discomfort. So what happened with the shortness of breath is the difficulty to breathe. Because let's say you have um let's come up with that again. So let's say that you have a blockage here or here. Okay, so that's meaning your body has less oxygen. Okay, so that's meaning the blood flow who's coming from your heart, they bring less oxygen, into your lung. So that's why that you will have the difficulty to breathe. Okay, so you have less oxygen, because of the heart attack. So you will need, that difficulty to breathe will be there. And also, an other sign of heart attack can be cold sweat. You will be sweating. You will have you will also feeling an unusual fatigue. You're tired because you have less oxygen, into your body. So that will make you feel lousy, uh, tired, fatigue, and also nausea. Also, you will have that GI discomfort, and also you can have a light headache. So, by having less oxygen uh, uh, flowing, into your brain, so you will have that. Okay. So again, the warning sign. So this is the warning sign of heart attack. So if you have a partial blockage or complete blockage into your heart, we call it an heart attack. If you have a partial blockage or complete blockage into your brain, we don't call that an a heart attack. We call that a stroke. Okay, this is a stroke. But both conditions, they are emergency medical, which means you need to call 911 immediately if your loved one or you experience those symptoms. Either it can be symptoms for heart attack if the blockage uh, uh, is coming from your heart, or if the blockage is coming from your your brain. By the way, your brain can be a blockage or bleeding. Okay, so if it's into your brain, then we don't call that heart attack, we will call that a stroke. So what is the warning sign now for stroke? Okay, the warning sign for stroke will be sudden numbness or weakness of your face, of your arms, leg, and especially on one side of your body. So let's say that the blockage is in, let's say that the blockage, the blood clots or the bleeding is in the right side, all right? So the numbness and the weakness will be the opposite side, which is the left. So that's why they said the sudden numbness of weakness of your face, your arm, your legs, especially on one side of your body, on one side of your body. So how the medical people will know which side is by doing a CAT scan. So when you uh, present to the emergency room and you represent with sign of symptom of stroke, um, so the first thing they are going to do is a CT scan to see what's going on, if you have a blockage, if you have a bleeding, so they can know what kind of treatment to start. And also, the other warning signs for stroke is sudden confusion, trouble speaking, or understanding. So again, depending where is the blockage and the bleeding, in your brain, your speech will be impaired. Okay, most likely is frontal. They said, uh, you know, part of your frontal head. The other sign or symptom is sudden trouble of seeing in one eye or both eyes. So again, depending where is the clots or the bleeding in your brain, that will affect. If it's close to your optic nerve, which is your nerve who's control your eyes, that can make you, um, have trouble to see. And the other symptom also for uh, the warning sign also is harder than trouble of walking, dizziness, low balance, or coordination. Remember, I said, let's say you have a blood clot or a bleeding in one side of your brain. So the other side, the opposite side, that's where is going to be affected. So you might you might not be able to walk at all, or you might be able to walk but with difficulty. And one of the warning sign of stroke is sudden severe headache for no cause. Okay, people uh, usually don't know where that headache comes, but you can have um, that symptom as well. Okay, this is a warning sign. So again, the warning sign for stroke is sudden. So everything is sudden. It's not chronic. Okay, it's acute. It just come. So you have sudden numbness or weakness um, of your face, of your arms, leg, especially in one side, and sudden confusion. Let's say that person was fine, was talking to you, it was alert to name and place and everything, and suddenly that person become confused. That person doesn't know where she or he is. They don't know the date. They don't know their name. So this is a warning sign for stroke. Okay, and that person that person used to speak well, and suddenly that person has difficulty to speak, or sometimes they have, they are drooling, they have one side it's turning. So think just think about that. And sudden trouble seeing, that person was able to see, and suddenly, that person said, oh, I cannot see, or I have difficulty to see. So this is a warning sign, so you need to call 911. and also sudden bubble of walking. Person used to walk. Person was walking this morning, and then all of a sudden, all of a sudden that person they cannot walk, or that person is limping for no reason. So they needs to go to the emergency room to check that person to see what's going on. And lastly, sudden headache. Um, headache, when people have headache, we have migraine. Some people have migraine is chronic, they have it on and off. But any sudden headache should be uh, further evaluated, because beside the stroke with a headache, when someone have COVID-19, one of the sign of symptom of COVID-19 is also headache. One of the sign of somebody have cancer can be also headache. Let's say that someone, let's say a female has breast cancer, and that person, they have breast cancer, they went to the doctor, they have the surgery done, they have the chemo done, and everything, radiation, everything is okay. And that person went back and they said, oh, you know what, everything look good, you're fine, just take your medication, whatever they gave that person. And let's say after 6 months or after a year, that person have a sudden uh, headache. Don't wait. Okay, call back your physician or your provider, and contact your oncologist. So they need to know, because the first one of the meds, one of the site, the breast cancer, they can spread is your brain. So the sudden headache can be a sign of your cancer is coming back. Okay, so the headache can be, yes, it can be the stroke, a warning sign for stroke, but also it can be different things, like, as I said, like the COVID-19, like metastasized from breast cancer, and can be also metastasized from lung cancer. So all those things we need to know. That's why it's so important to know the sign of symptom of different diseases. So really we know when it's important to seek for help. Okay. So again, everything sudden, every symptom is sudden. That means your body is telling you something. If something is not working well, so you having, there's something you're having, so you need to seek for help. So you cannot wait for, oh, I'm going to wait, I'm going to take tea to see how things will do. No, call 911. It's better you go to the ER. They tell you, you know what, you don't have nothing, you fine. Instead of you have those symptoms, you were careless, you are afraid to go to the ER to see what really is happening. Is, I cannot stop emphasize how important it is to seek for help, because the earlier you seek for help, is the outcome will be better. Okay, so we have that acronym for that. The acronym is act fast. So fast is the acronym. Okay, so what fast mean? So if you feel that, okay, you or your loved ones or your friends has a warning sign for heart attack, either heart attack means it's coming from your heart, okay, or a warning sign for stroke. Warning sign for stroke is coming from your brain, from from your head. There's the acronym uh, name fast, is to make it, it's a way that you can remember. So that's why we have a acronym. So remember stroke warning sign with fast. So fast, F for face, okay? Face, you ask the person to smile, right? Does one side of the face drop? So if that person, you ask the person to smile and one side is not symmetry, is not equal, this is a warning sign for stroke. For stroke, correct. And the A for the fast stand for arms. So you ask the person to raise their two ends, and if you see one drop, okay, so one is dropped, they cannot do like that. It's a sign of symptom for the stroke. Also, speech. Ask the person to repeat a phrase, a simple phrase. It doesn't have to be a long phrase. Just tell the person to repeat a phrase like, the cat is black. The sky is blue. Um, and is their speech or slurred? Slurred, that's meaning, is very slow. They have difficulty to speak. Um, or or strange. So this is a warning sign for stroke. And lastly, the time. Okay, if you observe, so the time is important. Okay, that's why the fast mean the acronym for fast. F, face, asks the person to smile. If that person one side is dropping, like is not symmetry, so this is a red flag for stroke. The other one is arms. If you tell that person to raise their arms and one arm go up, down like this, it's a warning sign for stroke. And speech, if their speech, is not fluent, if they have slurred speech, very slow speech or strange speech is one of the signs. And timing. Time is very important. This last one is the time. Time, don't wait, call 911. Don't don't call your children or call your neighbor or your friend to come and bring you to the hospital, because by the way, when the 911 come, they will bring you to, if they suspected that you have stroke or you have a heart attack, they will bring you to the hospital who is closer to your house, because they know that timing is an essence. The timing is important. Okay, that timing can be your life and death. So the sooner you have the symptom, the sooner you get treatment, the sooner you seek for help, is the sooner you can recover fast, and the damage also can be limited. So if you wait too long, the damage can, you can have damage, and the damage won't be reversible. You won't be able to reverse the damage. So I cannot tell you how many individual, how many people who is in nursing home because of that, because of those, the heart attack, the stroke, and then sometime it's too late and they have sequela, which they cannot walk, they cannot take care of themselves, they cannot live by themselves. So they have to go to a nursing home, because most of the time their children, they are working, they cannot take care of them. So that's why it's important. I cannot emphasize enough how important it is to recognize those signs of symptom, the warning, the red flags. Okay, as I said before, it's better that you go to the ER, which is the emergency room, and they said, you know what, we check everything, everything is fine. They do the X-ray, they do CAT scan, there's nothing. So it's better to be safe than to be sorry, like people said. So that's why it's important. Always remember the warning sign. Okay, again, heart attack warning sign is chest pain, chest discomfort, you cannot breathe, shortness of breath, nausea, vomiting. Nausea, vomiting, mainly the women, they have the GI symptoms. And back, you can have back pain. The pain comes from your heart, and it can spread into your arms and into your back and into your neck and into your jaws. Okay, so if you have those, those pains, seek for help. Chest discomfort in your upper body, from waist up. Um, you cannot breathe, as I said. And other sign can be cold sweat. People are sweating. Okay, you have pain and you sweating is a red flag. uh, Unusual fatigue, you feel tired, you fatigue, nausea, and you have lightheadedness. Repeat again. For the stroke, the warning sign of stroke is sudden. Everything is sudden for stroke, right? You have sudden numbness or weakness in one side. Okay, think about stroke. You have sudden confusion, trouble speaking or understanding. You weren't like that this morning, and all of a sudden, you become confused, or your loved one become confused, not the same. So it's a warning sign for stroke. Sudden difficulty to see. Okay, so depending where the blockage or the bleeding is, inside your brain, if it's close to your optic nerve, which is your eye, the nerve who's control your eyes, you will have that issue, the difficulty to see. And also walking, depending which part of your brain is affected, you will have difficulty to walk. And sudden headache also, this is all the warning sign. But don't try to treat it yourself. Don't try to say, okay, let me see if I'm going to feel better, let me take some tea. No. If you have all those red flags or warning sign, please call 911, because the timing is in essence. The timing can make a big difference how you recover. Some people, they have stroke, heart attack, they recover well, and some no, and some die. And as we said before, 50% of people with heart attack, they die if they will they will if they don't seek help, okay, fast. 50% who have heart attack, they will die. So it's important. I cannot emphasize enough how important it is to seek for help, to call 911. That's what you need to do. Call 911. And also the provider who's going to um, see you if you have heart attack will be a cardiologist. Let me put that. Um, all right. So I am looking for. Sorry, I'm looking for something. Where is my? Hmm. Okay. I don't know where's my thing. Okay, so the the provider who's going to follow you. Sorry, I have to pick up something. Yeah, okay. So you need to know, okay, let's say you have heart attack. So the provider who's going to follow you with that um, a heart problem will be a cardiologist. Okay, this is the heart doctor. All right. The the cardiologist will follow you, will see you, in the beginning, because they are the one who's going to do the cardiac cat, the surgery. They're going to go inside to see what you have, how extensive is the damage, inside your heart. And also after that, you need to follow this, your cardiologist. Please, if when they give you following appointment, follow up, please go to see them, Go to see them because they are going to put you on medication like blood thinner. They are going to put you on blood thinner. So you need to follow with your cardiologist closely, and the other one who's going to tell you when to stop it. And then also the other one also who's going to tell you, okay, now you are good. Now you can go back to your PCP, to your primary care provider. You can follow up with them. But please, if you have a heart thought attack, um, this is the provider of choice you need to follow, because the other one who really specialize in your heart, they know, how to control your blood pressure. If you have a blood pressure issue, they will help you with that. And with your blood thinner, they will know when to start it. Usually a heart after a heart attack, they put you on some medications, and then they tell you to stop after 1 year. So you need to follow closely to the cardiologist. Whenever appointment they give you, don't miss it. Go. If you cannot make it, call the office and change the date so you can follow. I cannot emphasize enough. Follow. Once you have that disease, hopefully you don't, but if you have it, please follow through with your specialist. So if you have a stroke, for the stroke, the provider is a neurologist. It's not the same, okay? A neurologist is for the stroke. If you have a stroke, everything is in your brain. So it's the brain doctor. Neurologist, you need to follow that specialist also closely after a stroke. They are going to put you on medications. Some, especially if it's a clot. If let's say that stroke is caused by a clot, you will be on medication. If it's bleeding is caused by bleeding, that's different. You cannot take no blood thinner. So it's important. I cannot emphasize it enough to follow your specialist. Okay, if you have a heart attack, it's a heart doctor, cardiologist. If you have a stroke in your brain, something in you coming, something, the stroke is related to your brain, you need to see a neurologist. So it's important to follow through. And that, okay. So, everybody would like to be healthy. Everybody would like to stay healthy, but it's not the case. It's not the case. The case is we found that more and more people, they are getting sick. Can be related to different causes, but my main concern is what to do when we have those signs and symptoms. We need to be knowledgeable. Okay, we need to know so we can seek help that we need before it's too late. So we can say, what can we do to decrease the risk? What can we do to decrease the risk of having heart disease, stroke, or different stuff? So first of all, you need to control your blood pressure, especially for heart thought attack. One of the condition who can increase. Okay, you know what? Let me see. Okay. This one we have to talk. about it. It's important. So one of condition who can increase the risk of an heart attack is atrial fibrillation. Okay, atrial fibrillation is one of the conditions. Okay, what is that? In atrial fibrillation, it's like any healthy person, right? Any healthy person, their heart rhythm is sinus rhythm. So sinus rhythm, that's meaning you have a nice P wave and you have a nice QRS wave and a T wave. This is sinus rhythm in any normal healthy person. So when the person is not healthy, okay, the heart is not healthy, there's a condition called atrial fibrillation. So in atrial fibrillation, instead of the ventricle, pump the blood, into pump the blood into the atrium, go do whatever they have to do. What they do, they they they're just doing like this. Okay, they don't pump the blood, so the blood stay like that. So if you have a blood is doing like this, it doesn't flow the way it's supposed to flow. You have more risk, you prone to get blood clots. So is that blood clots, is that blockage can cause that. So that's why people who has atrial fibrillation, they are on blood thinner. The blood thinner can be anything from Coumadin, like same thing with WAF. Okay, so the person can be on blood thinner. This is important. I'm going to tell you guys about this. There's a different blood thinner, right? So that person can be on Coumadin. It's the same thing. Oh, warfarin is the same thing. All right. So now we have because when somebody is on Coumadin or warfarin, they need to do their blood works every month. Then they need to check their PT and INR. Okay, this is a blood work who tells you how your blood is coagulated. So let's say that your PT is high, it's very high, so they have to decrease the medication. If your PT is low, they have to increase. So this is a blood work. If you are on Coumadin, so you need to do it. So now in days now, they come up with newer medication, new anti-coag. So we can have apixaban. Okay, apixaban is one of them. Roxavaxaban, you can have so they are different. So you don't need lab works. So people like it better because no one really likes to be stuck like every month. So I'm saying that to say that it's very important when you have that condition, atrial fibrillation, to take your medications. Because if you don't take your medications the way the doctor prescribe it, that's when you will end up with an heart attack. So it's important to take your medication as prescribed. If you have any bleeding while you're taking that, because it's a blood thinner, so what it can cause, one of the symptoms, the symptom, it can make your blood to thin. So that's meaning you are high risk to bleed. So you have to be careful not to fall, because when you fall, you can bleed internally inside you, especially if you hit your head. Let's say you are on blood thinner, you fall and you hit your head, you need to go to the emergency room as soon as possible. They need to do a CAT scan to see if you have any bleeding in your brain. It's very important to go and find out if you're okay. Okay. So if you have atrial fibrillations, AFib, that's how we call it AFib. and you will be on blood thinner, except that sometimes we don't put people on blood thinner if they are high risk to fall, such as people who are Parkinson's disease. They don't have their gait, it's imbalance. So you have to weigh the risk, the pro and con. Your doctor or your provider will do that, but most of the people who has that condition, atrial fibrillation, they will be on blood thinner. And when you are on blood thinner, you have to be careful about bleeding. So, um, it's not advisable to use, the regular razor. You need to use the electric razor, because with that you will have your risk for bleeding is much less. And also any sign of symptom, if you're spitting blood, if you have epistaxis, which is bleeding nose, if your urine is bloody, if you have blood in your stools, you need to call your doctor. He needs to know. Don't sit on that. Don't try to wait, because you need to go to see the doctor. They have to do lab work to see what's going on and how they can adjust your medications. Okay, so hopefully that topic has helped you, because I think with heart disease and with stroke and with heart attack, I will I will talk about it so often, because it's an epidemic, it's a pandemic. More and more people, they're affected with that, and sometimes the sign of symptom is overlooked. Um, and then it can be too late. It can cause so much damage, into your body. So it's good to know. And I think, that's why I love health promotion and disease prevention. Okay. It's good. This thing, if we can prevent, the best thing is to prevent all those symptoms before it's happened. But most likely it's not feasible. But if we can recognize the symptoms, at least we seek help immediately, and that can help us to recover fastly and have less damage into our body. So um so what can we do to decrease the risk? Okay, so what can we do is, if you have blood pressure problem, if you are diabetic, if you have high cholesterol or high triglyceride, they give you medications. Take your medication as prescribed. Okay, once you control them, the risk to have more damage is less. So if you have those things, take those medication. Um, you know, um, that's what you have to do. And Mediterranean diet, which is eat more fruits and vegetables. Um, try to use less oil, use olive oil, and try not to eat, no added salt diet. um, if you eat meat, try to stay with your white meat and be active. Okay, I cannot say, because when you're active, your blood is circulated, into your body. Your blood is not stay stagnant one place. That's why being active, walking, swimming, exercising is good. You need to keep active. It's like me, even though I don't um register into the gym, but at home, I try to do like my 15 minutes. I'm trying to do my dancing, my yoga. Whatever you do will count. Like, let's say you go to a store, if you can park the farthest to from the front door, as far as you can, you're walking back and forth, that will help you too. And also reduce stress. So yesterday or this morning we were talking about stress. Everything will give you stress. If you can walk away, because stress can cause so many damage as well. So this is the way you can decrease your risk for having, heart disease or heart attack, um, stroke. Okay, so again, if you have the provider of choice, If you have heart attack, you need to be followed by a cardiologist, heart doctors. And if you have a stroke, your provider of choice is a neurologist. So, which can evaluate you, treat you, and you need to follow up with them. Okay. And also, I can tell you that you need to be on top of your game because there are so many patients. They're not going to walk. They're not going to run after you to call you, to beg you to follow with them because there are so many patients. We really are in health crisis. I don't know if you can see that right now as we speak. The hospital, they don't even want to keep patients in the hospital. Okay, when your loved one is sick, you need to be the advocate, to make sure that they are ready to be discharged, because what I've been seeing, that they want to discharge the patient as soon as possible, even though they're not ready to be discharged. So you need to know you know you need to be knowledgeable. Okay, that's why information is so important, and that's why I have decided to do what I'm doing now, to do a YouTube channel just to go and educate the population, people who wants to be educated, that we have diseases, we have to deal with them, and if we can prevent them, we will prevent them. But once you have them, what are the signs or symptoms to look for, and you can seek help. um, so, having said that, remember that nobody has perfect bill of health. Nobody has 100%. No one is 100% healthy. So everybody, they are striving to have an optimal health. Okay, and optimal health by saying that you don't have no acute diseases. Okay, everything is stable. Your lab work, they are good. If you have high blood pressure, they are controlled. If you are diabetic, it's controlled. You're taking your medication on time. You're trying to live an active life. You're trying to reduce your stress. You're trying to eat well. You're trying to sleep. um, so all those things will help you. Okay, so having said that, I wish you the best of health, and next time I will come with another topic. So on that, I tell you, stay well, stay healthy, and and just try to live the best life you can. Okay, reduce stress. I cannot um, mention that enough about stressing. So whatever situation give you a lot of stress, just walk away if you can. Okay, on that, have a best of health next time.